If you have lower back pain, I'm sure you've heard of discs, spinal discs or intervertebral discs. These white things here, these are the bony structures. These are the vertebral bodies or the vertebrae. In between this sort of grey structure here, this is an intervertebral disc. Now discs are what allow your spine to move. It allows movement between two vertebrae. In the middle of a disc you see this. This is a nice plump balloon gel-like substance called the nucleus pulposus. It's what adds that sort of shock absorbance to the discs. Around it you have rings of fibrous material called the annulus fibrosus. It's a little bit like rings of an onion. So when you're young, when you're in your 20s or even early 30s, you should have nice, healthy, plump discs like this. You shouldn't be getting any pain at this point. As we get older, the discs, the fibrous material of the annulus fibrosus becomes worn, it becomes slightly torn. You can end up with bulges in the disc where the nucleus material is starting to push out. At this point, it can cause a disc bulge, and that can sometimes press on either the spinal cord or a spinal nerve root. That may cause you pain. This is the sort of presentation I would expect to see for someone who's in their early to mid 30s. As we get a little bit older, or not even older, but as we abuse our bodies even more, we can end up with a fully prolapsed disc where the nuclear material comes out from the disc. This would cause a lot of inflammation, that would cause a lot of pain. It can cause compression on either the spinal cord or one of the spinal nerves. And you could get pins and needles, numbness, or even just pain going down one leg or thigh. And that can be really quite painful. So most of these can actually be improved with the right therapy, with the right approach. You have to obviously take it at the right time, the right steps. So if you are struggling with lower back pain and you think it could be perhaps a disc problem, then why don't you message me and let me know what it is that you're struggling with. Let's see if I can help you in some way. If you do want to reach out, you can DM me on Instagram or message me on TikTok, or even send me an email to ashley@precisionwellbeing.co.uk.